Gulray, nutritionist and director, Oxymed Hospitals, take pleasure in welcoming the dignitaries, patients, staff, and participants for this 1-hour seminar. Diabetes mellitus, DM, commonly known as diabetes, is a group of metabolic disorders characterized by a high blood sugar level over a prolonged period. Diabetes is due to either the pancreas not producing enough insulin or the cells of the body not responding properly to the insulin produced. Symptoms often include frequent urination, increased thirst, and increased appetite. If left untreated, diabetes can cause many complications. People with diabetes can benefit from education about the disease and treatment, dietary changes, and exercise to keep both short-term and long-term blood glucose levels within acceptable bounds. Besides, given the associated higher risk of cardiovascular disease, lifestyle modifications are recommended to control blood pressure. It is with this intent of creating awareness that Oxymed has organized this diabetes and diet seminar. Mrs. Shehnaz Gulray is a consultant nutritionist and director of Green Coalition Network, an NGO dedicated to the cause of promoting a healthy planet. A postgraduate from Women's Christian College, she has 24 years of experience as a consultant for corporates, is a nutritional advisor for educational institutions, and a diet therapist for individuals. With a lot more to her credentials, we from Oxymed Hospitals bring you her rich expertise. Over to you, Shehnaz.
Thank you, Parveen. Assalamu alaikum and a very good afternoon to all of you all. I'm very happy to be here, but I think it's the first time I'm addressing for Oxymed on the Zoom session. I would like some of you all to keep your videos on because otherwise it seems like I'm talking to an empty audience. So some of you at least, please keep your videos on so it would be nice to interact. And it's nice that Parveen has already given you all an introduction on what diabetes is all about. Like she said, yes, it is something where a person suffers from uncontrolled sugar levels, where your insulin, either it is not being produced enough or it is not being utilized properly. So whichever the cause, you could end up with diabetes. And somebody was asking me sometime back about the gestational diabetes. Yes, some children develop juvenile diabetes, some women develop gestational diabetes during the pregnancy, and it just stays over. It does not go away, it stays over, and in any case, it has to be managed. And there are people who develop type 2 diabetes, maybe because of some other reason. So whatever the reason is, in some cases, family, your hereditary, your genes play a very important role in the development of diabetes. That I think is a very important thing everybody needs to know. Like it is said that if there is one person, that is if one parent already has diabetes, then you have 25% chance of you developing sugar. And if both your parents are diabetics, then you have a good 50% chance. But if you look at our lifestyles now, like, you know, the kind of lifestyle we lead, it's more of sedentary. We don't have a lot of physical activity happening. And the kind of food we eat, that is more of processed food. And a lot of other factors, and also people have already some other health issue. All this can contribute to people developing diabetes or blood sugar levels going high. Now, like she said, it is very important that it has to be controlled, because our body, if you look at it, is a very complex structure. All the organs are kind of interconnected with each other. So uncontrolled or untreated blood sugar levels, if they have stayed higher for prolonged periods of time, what happens is it starts affecting other organs as well, like your eyes, your nerves, your foot, your teeth, kidney, and many other organs can get affected. Now, I'm not trying to scare all of you all by saying that, you know, this is going to happen, but it is very important that you control and manage this disease, because there is no cure for diabetes. Once somebody develops diabetes, it's not just going to go away, unless it is a gestational diabetes where it's quite possible that, you know, you get over it. Otherwise, If you develop it, then you only have to manage. There's no other way to go about it. If you go to the doctor, I'm sure your doctor puts you on some kind of medication. Some people are fine just by taking a medication where the blood sugar is controlled with the tablets, but some people require insulin. So whatever it is your therapy regime, diet plays a very, very, very important role in managing diabetes, because diet is directly proportional. The food that you eat has a direct effect on your blood sugar levels. So that goes without saying, and that's the reason why diet control plays most important, a very vital role in controlling diabetes. So having said that, I would rather jump into the diet part of it, because I don't want to go too much into the medical jargon. Anyway, your doctors should have updated you. And if you look at diet therapy, there are three things that play a very important role. Number one is what you eat, okay? The kind of food you eat. Number two, how much you eat. In any other disease, if you see, what you eat and how much you eat will be important. But in diabetes, when you eat also takes precedence. When you're going to have your meals, when you have your snack time, all this becomes very important in a condition like diabetes. I'll go on and tell you that later, why it is important. So first, let's go to what you need to eat. So first, to understand what you need to eat, there must be some people here who already have been afflicted with the disease. So if you go to a doctor or to a dietitian, I'm sure your doctor says that, okay, these are the foods that are okay to eat. These are the foods that are best avoided. And these are foods that you should eat in moderation. So they just make a meal and they give it to you. Now, the reasoning behind this whole meal planning is that all foods, especially carbohydrate rich foods, they have something called a GI, that is the glycemic index. Okay, glycemic index is nothing but kind of a ranking system where you rank foods which will impact your blood sugar level or take it high. Those are ranked higher, and foods which will not impact it so much, where the blood sugar level is controlled, it doesn't go very high, those are ranked a little lower. So that is the whole way in which the GI works. But in my opinion, and in opinion of many of the nutritionists, and which has taken a lot of precedence now, is the glycemic load. In the sense, one is how you eat a food. For example, your doctor would have said, don't eat too many bananas, because the minute you eat your bananas, your blood sugar will go high and it will spike. So you are told not to eat banana. But then how does it actually work in a meal? Now, when you are eating a meal, you might be eating 3-4 foods together. How does it impact your blood sugar level after the absorption, and in collaboration with so many other foods, is what your glycemic load is all about. And that is where I want to give more importance. And I feel that once you get a hang of how the food works in your system and how it is affecting or impacting your blood sugar levels, once you get to know that, it will be easier for you to plan your meals. It will be easier for you to manage your blood sugar levels and make sure that it does not spike at all. So this is where I'm going to give more importance on the food aspect. So before we go into the glycemic load or how to combine meals, I want to just touch upon the various food groups, so you kind of understand what we are going to talk about next. See, the first predominant food group is our cereals. We all eat more of cereals. If you see a normal diet pattern, everyday diet, you have at least about 60 to 70% of your food comprising of the cereals. Now, cereals is where majority of your carbs, the carbohydrates, come from, and where it will directly impact your sugar. So this is a place where we really need to tread with caution. We have to be a little careful in this area, the cereals, where the carbs are loaded. Then you have your pulse category. Pulse also have some amount of cereal, some amount of carbohydrates and protein. It is a combination. But pulses, if you see, they won't impact your blood sugar level as bad as rice would does. So it will impact, but it won't spike it so much. So in comparison with rice, it is any day okay. So there are different kinds of pulses, all your dals, your lentils, the whole pulses like the chana, rajma, all those come in that category. So does soya also. I will specifically talk about soya a little later. And then you have your fruits and vegetables. Same again, under your fruits and vegetables, you will categorize them. I'm sure the doctor says that, you know, these fruits don't have too many of them, like your mango, banana, sapotas, they all come on the top because they kind of spike the sugar a lot. And then you have your citrus fruits, your apple, guava, papayas, they all come a little lower because you're not going to really affect your sugar as bad as the bananas would do, right? And then same goes for the vegetable category, where you have the starchy vegetables, vegetables which have more starch in it, like the potatoes, yams, colocasia, tapioca. They all come under the category where they are loaded with starch. So the minute you eat more of that, your blood sugar level will spike. But then you have the other vegetables like all your greens, broccoli, turnips, radish. All this will not spike it as bad as the starchy vegetables would do. And then you have the milk category. Again, milk also has some form of carbohydrate like the lactose, and that also will spike your sugar level, but it's not as bad as the cereals or the sweets that would do. Okay. Now, when you have your cereals, the worst of the kind I would first take up, and then we will slowly go on to the other cereals. The worst of the kind is your processed food. See, with the advent of, or the many inventions that happened and the science and technology that, boomed here, a lot of food started getting processed. So the worst of the order will be your white rice, the white sugar, and your maida, because all these are not only just carbs, they are pure form of carbs. So the minute you eat them, you can be pretty sure that your blood sugar is going to be risen quite high. So these foods are best avoided, but if you really need to eat them, I will tell you how you can combine it with other foods and how you can try and control your blood sugar levels to the best. Okay, so the first three foods that I told you about are the processed foods: white sugar, white rice, and white flour, which is your maida. And anything that's even made with that. For example, maida is used for all your cakes and baked items. Even when you eat those baked foods, again the effect is going to be same as you would eat maida in any other form, like as a roti or a naan. Okay, same goes for the sugars also. So this category, you should remember, any processed food, you try and you limit it as much as possible if you are a diabetic. Even otherwise, processed food is not so good. So it's better that you keep it as minimal as possible. And then we have the different kinds of rice. Now, when we say that white rice is not good, you avoid that. The white rice that I'm talking about is the white, polished, refined rice. The whiter the rice, that means it is polished more and it is refined more. So those are best avoided, not all kinds of rices. Now you can see there are many different types of rice available. One is your parboiled rice, then you have the brown rice, then you have the black rice. I don't know how many of you all are familiar with the black rice. There is one variety which is supposed to be very good and which actually beats even, it's even better than wheat flour if you look at it. But many of us are not aware of it, and so it's not so popular. But if when I say you don't eat much of white rice, you could go in for the brown rice, because brown rice is comparatively, the GI, the glycemic index, if you see, it is much, much better than the white rice. So these are the different types of rice that you can opt for instead of white rice. And under that also, sticky the rice in the sense, when you cook the rice, if the starch content, sometimes when you cook the rice, you can see the starch starts kind of oozing out and it becomes more sticky. That's one particular type of a rice which is best avoided, because those kind of rice kind of spike your sugar a lot. So go in for the medium grain, go in for parboiled rice, go in for brown rice, and try and avoid the sticky rice. Okay, once we finish the rice, we come to the wheat. Wheat is any day better than rice, because satiety value, if once you eat a roti or say any form of wheat, satiety value is more, you feel full, you don't feel hungry for a long time, and the way it impacts your blood sugar level also is not as bad as white rice. So any day wheat flour is better than the rice. And then you have the other kinds of cereals. See, the other kinds of cereals were not so popular earlier because, like I said, everybody was, trying to have more of processed food. But now I'm happy that, all these millets, bajra, ragi, they're all back on the scene. And you must be amazed when I tell you that, bajra, barley, these have a very good effect on the blood sugar level, in the sense I have personally seen where people eat bajra roti for dinner and their fasting sugar comes down to about 70 or 80. So bajra has that effect, and so does the other millets also. So wherever possible, if you incorporate your diet with more of millets, bajra, ragi, and ragi is not so great with the sugar levels, although the nutrient content, calcium, all that is very good in that. Ragi does spike your sugar a little bit, so that you have to use with caution. Okay, but please understand that this is not a seminar where I'm just going to tell you, you eat this, you don't eat this, and then we are done away with it. That's not the whole purpose of this seminar, because I strongly feel that, when you have a diet, or when you work on a diet, or when you have a patient who has a particular problem, as a dietitian, if you're just going to tell, these are your do's, these are your don'ts, it doesn't work that way, because we definitely do get tempted with the kind of food available. We do want to eat something out of the ordinary. We do want to eat what is mundane and being cooked at the home also. So it would be practical to make a diet which would be beneficial to the patient. So that is what I'm going to talk about today, where you work on a combination. You work on a meal in such a way that you get to eat what you want to eat, but at the same time, you control your blood sugar level by eating more of food that has low glycemic index and less of food that have high glycemic index. So if you combine it in this proper manner, trust me, it is easier to plan your diet, and your blood sugar levels also remain under control. But I have to give you this disclaimer that, these are guidelines, all right? But please do work with your doctor or with your dietitian, because everybody's case is different. You might have somebody who has very high sugar levels, somebody might be only in the borderline. So if somebody who is, in the borderline case and who's exercising very well and who's really fit, and then they go on a very low cal diet, or a diet only predominantly of low glycemic index foods, maybe if their medication is too high, they might go into hypoglycemia. So these are guidelines. Please take the advice, but if you have a condition, it's best you can refer yourself to your doctor or to your dietitian or a healthcare professional. Get the proper meal plan. Once you get a hang of it, then it is easier. So whenever you start a meal plan or something different, I always suggest you maintain a food journal. Okay, please write down, if you are a diabetic, I'm sure you have a glucometer in your house. Please check your fasting glucose levels. Please write down how much it is, and write down the food that you're eating. What is your medication if you're on insulin or on any particular tablet? Please write that as well. The dosage, when you're eating, how much you're eating, and what you're eating. Please maintain a journal so that you know that this food is affecting you in such a manner, so that after about a week or after about a month, it will be easier for you also to alter your diet as and when you want, and you will not go into hyper or hypoglycemia. All right. So when we talk about combining diets, let's start with the breakfast. All right. South Indians most predominantly eat idli, dosa, upma, pongal. These are the normal breakfasts that are made in the house. Now, not necessary that always you have to make your idlis with the rice and pulse combination. you can always do away with the rice and you can have some other source of cereal. Like for example, you can have oats, you can have bajra, you can have barley, you can have any form of millets. You can combine that with the pulse and make your idlis. They come out really well, and please do try it. And definitely it will be a good option other than the normal idli. Now, for people who are die-hard fans of, you know, the normal idli, and they only want to eat the normal idli the way it is made, for them, if supposing you are eating 4 idlis in a day, then what you should do is you should restrict it to 2 idlis, and the other 2 idlis should be substituted in the form of, say, buttermilk, skimmed buttermilk, or in the form of, say, sprouts, or in the form of hard-boiled egg. So if you substitute it with something which has a low glycemic index, what happens? Your ultimate impact on the blood sugar level is not very high. Or if you have a normal idli, in the batter, you add a lot of vegetables. Just saute a few vegetables, add the vegetables to it, and make a vegetable idli. So what happens? Your rice content has come down, and it has been occupied by the vegetables. So again, your final output, that the way it will affect your blood sugar level, will not be so drastic. Now, say dosa. You don't have to normally eat the dosa the way it is made. You can make a dosa with different types of dals, or with besan, or with soya flour, because soya flour, again, let me stress, if you are able to like the taste of soya, because sometimes people do not like the taste of soya. So if you can eat soya the way it is, or if you can combine soya with any other cereal and make a pancake out of it, or make a dosa out of it, let me tell you, the way it manages and controls your sugar level is really good. It is any day better than your other cereals. So I strongly recommend soya for people who have diabetics. Just try a little bit. You may initially not like it, but if you work in combination with other cereals, I'm sure you will like. Well, once you see the effect it has, I'm sure you will want to eat more of it. So you can have that. Or for people who like pongal. Pongal not necessarily has to be made with the rice and pulse combination. Again, you can make pongal with a substitute like a millet or oats, or with barley. Barley and the moong dal combination is actually excellent, because the barley pongal comes out very well, and it has a very good control on your blood sugar levels. Make sure that your breakfast is eaten well. See, in diabetes, many people, what happens, they kind of skip the breakfast and they eat a very skimpy breakfast and they go on to a heavy lunch. That should not be done. Breakfast is one meal that you have to eat properly. Even if you're eating good carbs, I'm fine with it, because I feel that your breakfast constitutes a major portion of your diet. So eat a good breakfast. Don't go overboard. Don't eat too many carbs or too many white sugars or white maida or white rice with it. Make a combination meal. Like I said, you can make upma, not necessarily with the semolina. You can make upma with something called quinoa. That also has a very good effect, comes out very well. It is coarse, and the final product also is quite good if you add a little bit of veggies with it. So you can make your upma with that, or you can make a porridge, the broken wheat porridge, or you can make a dalia with, say, black rice. You can try black rice with a little bit of pulse, green gram dal, mix it together and make a porridge out of it. That also comes out very well. These are all breakfast options that I'm giving you. But for people who really eat only the idli and dosa the way it is, for those people, you should restrict the quantity. It's very important you bring down the quantity and you kind of increase the vegetables and increase, say, add an egg to it, or add some sprouts to it, or add a fruit chart to it, or you add, say, some buttermilk to it. So you add something else and complement that with the normal idli. It works fine, but the portion size has to be reduced. The serving numbers has to be reduced here. Now let's go to the meals. Again, with the meals, when I tell you, please don't eat too much of white rice, you will be wondering what else can I eat other than white rice. So instead of white rice, like I gave you the other options, you can eat the brown rice, which comes out really good. It's as close as the normal rice. And if you really must eat the normal rice, then go in for parboiled rice. Okay, that is a better option than the normal polished refined white rice. Okay, but here again, you have to work on a combination meal. What you can do is you have to reduce the quantity of rice so that it only constitutes, say, 1/20th. Like, I'll give you an easy way to portion your food. Say, for example, you have a plate, okay, the normal dining plate that you have, the 9-inch plate. In that, you should make sure that half of your plate constitutes vegetables, all right? And then 1/4 you have some kind of protein. It could be a dal, it could be little low-fat yogurt, or it could be a non-veg source, any non-vegetarian food. And only 1/4 should be your cereal. So in the case, if you actually have to convert that into a serving size, I would say 1 cup. 1 cup of cooked rice will what constitute that 1/4 of that plate. So that is all you should eat your rice content. Or if you want to make your glycemic index or your blood sugar not spike too much, then what you do, you remove that rice and substitute it with roti. Roti, again, you want a better form of cereal, then you go in for a combination. Say you can have 50% of wheat flour and 50% of soya flour, or 50% of multigrain flour or bajra flour and 50% of wheat flour. You can work different combinations, because all these combinations ultimately give you a low glycemic index, and it will help you reduce your blood sugar also. Okay. Now, if these are the different, and sorry, you can also have the different millets that I was talking about. Okay, the bajra and the barley and millets. Millets, I don't know how many of y'all have actually tried the millet rice. You know, you kind of make a rice out of millet. It doesn't necessarily have to be rice by just, you know, cooking it and steaming it and having it. You can always make, you know, a different form where you add a little bit of vegetables. And if you're I'm sure many of us are Muslims here, so you can add little non-veg to it and make it more interesting. All right, it doesn't necessarily have to be the way you eat a normal meal. It doesn't have to be like that. Okay, so that will be your meal. Now, with this, you add some potent hypoglycemic agents. There are a lot of foods which actually are very potent, which can strongly reduce your blood sugar level if they are eaten in a concentrated form. So I'll tell you some of those. So if you combine that with your diet, then what happens? The net effect is very good on your blood sugar levels. For example, fenugreek seeds. I'm sure many of, you know, as whoever is diabetic, I'm sure somebody would have told you that, you know, you try to eat the methi seeds, soak it overnight, and then morning you boil it and drink the water. Yes, it is very good. You should give it a try. So how I suggest to the patients is, morning when you get up, night, you please soak the fenugreek seeds overnight. Morning, you get up, take the water, don't throw it away, boil it again, and you have the concentrated one, just a 1/4 cup or something, you can have that. Then the other potent forms of hypoglycemic agents are cinnamon powder. Cinnamon also has a similar effect, so does turmeric powder. So again, I tell patients, either you can have fenugreek seeds powder in the water in the morning. You can have cinnamon powder water in the night, and in between you could have haldi ka doodh. You know, little bit of haldi, you mix it with milk or with water. You can have that. Then amla powder. Amla powder has a dual effect. Amla powder is very good because it helps in reducing the blood cholesterol level, and it also helps in reducing the blood sugar level. So it's very good that way. And let me tell you, turmeric right now has gained a lot of importance, because turmeric is supposed to be very good even to cure cancers. So see, these are all things that are good in the form of food. Doesn't mean that, you know, you don't take your medical therapy. Your allopathy is your allopathy. This food just complements your doctor's advice and your allopathy medicine. It will only complement it. This is not the only source of therapy for you all, but nevertheless, This is a very good form of helping to reduce your blood sugar level and reducing inflammation in the body and to cure your body of a lot of ailments and illnesses. Same goes with curry leaf powder. I don't know how many of you all have actually heard. Curry leaf powder is also a very potent form. See, these are things that I have personally tried and tested with my patients, and I have seen a very good effect. But like I said earlier, please work with a healthcare professional so that you don't go into hypoglycemia. So, like for example, if you've taken a lot of 2-3 potent forms in the night and you've also taken your insulin and you've slept, there's a very good chance of you getting up in the morning and having a very low blood sugar level. All right. So, the ones that I mentioned, for your sake, I will go through them once again. You have cinnamon powder, turmeric powder, and fenugreek seeds, the water. Then you can have amla powder, curry leaf powder, ginger garlic. Ginger garlic also is very good on the digestion, also helps in reducing your blood sugar level to some extent, not as well as cinnamon and turmeric and all that. And you have zira. Okay, so these are all forms of hypoglycemic agents which are available in our food, which you can incorporate as and when, so that you have a more controlled blood sugar level. Now, go after that, I would like to, somebody was asking me about, before we started off, there was one question about the number of meals. So I think I will touch upon that here. I normally don't say that you should only have a 7-meal pattern or a 6-meal pattern. Eating small meals at regular intervals is very good. But that's not the only thing I advise, because everybody's body is different. Okay, not necessarily that a diet that works for one person will necessarily work for somebody else. Or there might be one individual who is working, who might be very physically active, who might, exercise a lot. For them, I wouldn't say that this regime will necessarily work for them. For them, even if they want to eat 3 small meals with 2 small snacks, that's fine. Okay. And snacking, let me tell you, snacking is not something that you eat when you're bored and you're sitting in the afternoon, you're watching TV and you just want to do something, you start snacking. That's not the idea of snacking at all. Snacking is one when, if supposing you feel that your blood sugar is going down, or just so that it doesn't go down too much, so that, when your lunchtime comes, you have a controlled level, you want to have a small snack, that's fine. Go in for something like peanuts, not the roasted peanuts, simple, the normal boiled peanuts, you can have that, or normal roasted peanuts, or you could have some nuts, just a handful of nuts you could have, or you could have skimmed buttermilk, some light snack you can have in between, or even a soup is fine, a tomato soup or a barley soup or a vegetable soup, that also is fine. In between you can have that. So the meal patterns have to be fixed. This is where the thing that I was talking about, when you eat in a diabetic, for a diabetic, is very, very, very important. The other diseases may not have that precedence, but in diabetes, very important when you eat, because if your doctor has put you on one particular kind of a regime and you just go haywire on your diet, it doesn't work. Like let's say, for example, I was telling you in the beginning, you skip your breakfast or you eat a very minimal breakfast, you've already taken your insulin or you've already taken a metformin, and then you are doing your work, and then it is your lunchtime. Okay, your blood sugar would have already dipped a lot, and you would have so much insulin produced in your body, and you will need to eat something. At that stage, what happens, you don't actually look at what you're going to eat. When somebody's blood sugar is dropping, you just gobble up whatever is available. And the first thing that normally people do when they are going into hypoglycemia, they try to reach out to sweets. I just need to bring up my sugar level. So they kind of reach out to sleep. But before even they realize, they would have eaten about 3 to 4 either bars of chocolates, or they would have eaten some sweet or the other, and you would have spiked your sugar. Then what happens? You again want to eat your lunch. See, this is the total wrong way of doing it. If you do not have fixed meal pattern, then what happens? Your whole system goes haywire. So this is why when you eat is very, very important. Eating times should be fixed. So is your medication, so is your insulin, whatever your medication regime is. Please follow that, and please follow fixed meal times. This way, there will be controlled portions. You will know what you're eating, and you will know what is the net effect. You know that you eat this is what you're going to eat, and then your postprandial sugar will go to this extent, and then it will come down at this level, and then you can have your next meal. If you do not have fixed meal times, it's utter disaster. And then in the midnight snacking should be strictly avoided. Whether you are a diabetic or not a diabetic, I strongly feel that you should not snack in the middle of the night. Most of them have this habit of sleeping late. They finish dinner by around 8:39, and then they might be sleeping only by 1 or 2. So in between, they feel hungry and they start snacking. Again, that is a very wrong method of doing it. Again, somebody was asking me about intermittent fasting. The whole idea of intermittent fasting is where you have few hours of no food at all. You eat few hours, you don't eat few hours. That's the whole idea. Now, when you don't eat few hours, some people go as much as not eating for about 14 to 16 hours. They don't eat, then they eat only for the remaining hours, 12 to 14 hours. But what happens for diabetics, I don't strongly recommend, something like that. I feel at least 10 hours. 10 hours, it's okay not to eat. You finish your dinner, say by around 10 o'clock. For the next 10 hours, please don't eat anything. It's fine. This kind of night, if you're going to unless your sugar is going low, or if there's some other issue, then it's fine. In the absence of any other problem, I think at least a minimum of 10 hours of fasting in the night should be there, because that is a better way of controlling your blood sugar levels. And then let's also touch upon the weight control. Yeah. Many people who are diabetics also are overweight or also are obese. So it is very, very important that you control your weight. Now, the kind of diet that I'm talking about, hypoglycemic diet, that diet combined with not a very high intake of fat. Okay, when you combine that and put physical activity along with that, your weight control also will simultaneously be taken care of. And this way, your blood sugar level also will be taken care of. It's very important that your blood sugar, your weight, all are under control. So it's very important that if you are obese or overweight, you kindly take care of your weight aspect as well. And then physical activity. Physical activity is so very important in today's world, which is really neglected to a great extent. And now with the pandemic, I think it has really brought it down. I think we should go out and walk or take some kind of a hobby where you kind of expend some energy or the other. Especially if you're a diabetic, it becomes all the more important. So please take care of your physical activity, not only just even in the house, if you're working in an environment where you're, say for example in an office, try to walk around a little, try to take the stairs. Don't be stuck to your desk, because this, again, the more you sit and become sedentary, you're not helping your body in any way. All right, so that is another thing I want to tell. And I told about the food journal and exercise. And yeah, the other thing is somebody was asking me about sweeteners. Okay, I am personally not a very big fan of artificial sweeteners, because years ago, I have read so many, not just years ago, even if you see the course of time, so many sweeteners and artificial agents keep coming up. And then the way they impact your system after a long time, the kind of tumors or cancers they produce. After reading all that, I'm very skeptical about advising sweeteners for my patients. So I normally don't do that. Instead, I tell them, please restrict the sugar. You shouldn't be taking a lot of white sugar. Like I said, it's not good for you. Now, instead of white sugar, you may ask what to take. Somebody was asking me about stevia. Yes, stevia is a natural sweetener, and it's quite sought after now, and it's supposed to to be really good also. So if you must take, then yes, you can go in for stevia, but I strongly do not advise any other sweetener of any other form, like the aspartame or whatever is available. Stevia is fine, but instead of that, you should go in for brown sugar in restricted quantities. Like for example, if you're used to taking your coffee with say 1 teaspoon of regular sugar, I would suggest that in the beginning it will be difficult for you. So start off with 1 cup of your coffee with say half a spoon of brown sugar. Start it off like that, slowly taper it down. You will reach a stage where you can drink your coffee without any sugar. It is possible. You just have to give it a try. Once you taper down anything, it becomes easier. Only when you drastically stop something, you're used to something, and then you stop it all altogether, it may not happen. All right. And then somebody, I also wanted to tell about honey, because these are the usual questions people ask me. Can I take honey instead of this thing? Honey is good, has a lot of medicinal properties, but honey also has calories. So it's not like it is not going to impact your sugar level. It will definitely impact your sugar level. So has to be used in caution. But there are some forms of honey which have a lot of medicinal value. So if you must take, then it's fine. But have it just maybe, you know, like some people have this habit of taking warm water with honey, just half spoon of honey. If it is for medicinal reasons, you can take that, but don't add honey in every cup of tea or coffee that you're taking. I wouldn't advise any of that. And juices. Many people also have this habit of drinking a lot of juices in between. See, what happens with juices is sometimes when you're eating a fruit, like just practically think, when I'm just telling, try to imagine and think. You have an apple in your hand, okay? It would take about 10 minutes for you to actually eat that apple. But if you have a grape juice in your hand, you're just going to gulp it down in no time. And the juice actually spikes your sugar to one extent. The apple, since you're eating it for a longer time, there's so much of digestion happening in your mouth, and then it goes into your system. The sugar level is not going to drastically go high as it is going to go high for the juice. So we always suggest that you eat apple, any fruit as a whole, rather than juicing it up. But if you must, if you really like to have, then don't strain it. Maybe have it with the pulp. At least you will get all the nutrients. But try to eat more of the whole fruit than the juices. I think I'm pretty much covered all the things, unless I've forgotten something. But I think we can just open it for question answer. Otherwise, it seems very monotonous for me also. And I don't see anybody there. So I think we can, yeah.
Yeah. So I think that was a really great interaction. I mean, advice from you, Shehnaz. As always, we'll always look forward for that. So now we have the question and answer session. We open the floor to the question and answer session. If you have any questions, you may press the raise your hand icon from the bar provided, and then ask the question to the speaker. You may also type your
question. People have just written something.
Yeah.
So
Can you take that?
Yeah, somebody has written, what about Japanese rice? Okay, yeah. So Japanese rice also is not very good on the, it is not very good on the glycemic index. It is okay. I won't say it is.
Shehnaz, assalamu alaikum.
Walaikum salam.
My name is Shazi. I am Parveen Appa's cousin brother.
Okay.
Firstly, I'm happy to be on this.
From Hyderabad.
I live in Hyderabad. And I also am dealing in the business of nutrition for the last 21 years.
Okay.
So I'm so very happy that I got invited. Parveen Appa, first of all, thank you very much for remembering and inviting me. And Shehnaz, thank you for all of the information that you shared. It's so valuable, so fantastic, so amazing. And so some of the questions that I primarily, what was running in my mind.
Okay.
By the way, I'm not diabetic, and Allah ke fazal say, you know, my wife is not, my children are not, my parents are not, and luckily we're devoid of that particular, unnecessary, challenges of life. But however, because I do help a lot of people in terms of their diet, also apart from, so I deal in Herbalife. So I help people with, which is a low
Oh, okay.
yeah, so it's a low glycemic
Right, I know.
meal. It really helps people. But obviously, I'm very happy because I'm also able to understand with what you shared today about okay, what to eat and what not to eat and what helps and what not, and everything. It's all a balance. At the end of it, it's all a balance about how your lifestyle, your eating habits, and all of it. So that's very clear. So some of the questions I had, one of the question I had was, I'm told that the Japanese rice. I mean, I'm married to a Japanese, okay,
Okay.
and so I'm told that the Japanese rice is very less in terms of affecting the diabetics, and we primarily use more Japanese rice in our house, as well as, like you mentioned, the brown rice, which is very nice, and all the unpolished rice. But I still had that question because when you were talking, you said that sticky rice could have some certain challenges in terms of your diabetic. Okay, so this is one question I had. The second question I had is that during your entire, you're sharing such lovely, knowledge to us. आप खाली एक चीज भूल गए कि हम लोग मुसलमान हैं ज्यादातर. So what happens is that we kind of I mean, idli vada dosa is okay.
No, she told me about her patient. So I was thinking a lot of South Indian patients would be there, but I will tell you about the Muslim.
थोड़ा मुर्गी, थोड़ा मच्छी.
क्या वो पाया खुरमा सभी
I'll tell you. Yeah.
आया खुरमा है तो वाह 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 वाह.
I'll to answer your
Please,
question.
please.
Yeah, if you see our typical Muslim food, like say biryani or ghee rice. Now, when we talk about a vegetarian meal, we are only talking about rice and its effect on the blood sugar level. That's it. But when we talk about our food, we're talking about rice in combination with fat. Right? So that is a deadly combination, if you ask me, because if you look at idli will spike your sugar and it will bring down also.
Absolutely.
The food that we eat will take it up and it will remain there for quite some time and then it will come down. So ours is a combination of rice with fat. Whether the fat is in the form of your paya or in the form of your meat, whichever way. If you see, typically when you eat biryani, it will go up and it will be there. The sugar level is there for some time and then it comes down because in fats there is slow release.
अभी वो बिरयानी खाने का हम लोग को मौका ज्यादा नहीं मिलता, even though I live in Hyderabad. वो परवीन आपा मुझे नहीं बुलाया अभी तक, बहुत दिन हो गया. But in reality, my question would be again, what if you have a very staple fish diet?
Fish is very good, yes. Fish, if you see, that's why the Mediterranean diet is very famous. If you look at the Mediterranean diet, it is supposed to be very good because fish has all the essential fatty acids in it. The good fat, if you put it in terms, that is the good fat which will not only impact your sugar in a good way, but also your entire body in a very positive manner, and it will also increase your the good fat in your blood, the lipids and all that. That also will impact in a positive manner. So a fatty fish diet also is very, very good. So it is a very positive thing. So if you are, that's why I said when you're eating your food, make sure you have more of vegetables. Have a good amount of non-veg in the form of fish is always better, and then you have limited amount of rice. So that combination will work well.
Yeah, basically 3 portions of your plate. One is fiber rich and nutrient rich. One is with a little bit of carbs, and one is protein.
Right. Correct? Right. Yeah.
We portion size it. So what about eggs and chicken?
Yeah. See, eggs, if you see, egg also does not impact, if you're talking about blood sugar level, no, it does not impact it so much, especially if you take a hard-boiled egg, it is not that bad. So you could have it. Chicken also is fine. Only Meat in combination with rice, like I said, yes, it is a bad combination. But if you're taking, like if you want to have chicken gravy and 2 pulkas and a lot of vegetables, it's fine. You can still have that. That's not a problem. Go easy on the oil. See, oil will definitely not, it doesn't have a glycemic index per se, but then it is full of calories. See, one gram has 9 calories. So the more the oil you add, your calorie content of your diet will anyway go high. So you have to go easy on the oil. Use minimal oil, but protein is fine. You can still have your protein, vegetables good amount, and limited amount of rice.
So when we talk about oil, see, we at our house we try to use a lot of olive oil and sesame oil.
Good combination, yes.
Is that the right thing to do?
Yes, because sesame oil is a medium chain fatty acid, that is. And olive oil, I'm sure you don't use olive oil for any of the major cooking. You must be using it only for your salads, or if you're grilling something, you must be using for that. So it is a very good combination. You can use, actually, I normally say a combination of 3 oils works best. Okay, I also tell people to take a lot of rice bran oil, which is also very good. But nevertheless, the oil that you're using, rice bran, yeah. But the oils that you're using, the sesame oil and olive oil, is a very good combination. So you could.
Of course, we use the regular oil also for some little bit. वो तलना के वो time में कुछ to be that we cannot control.
Right.
But on a general note, we try to keep a balance. Now, my next question is, what is your thought about chia seeds?
Yeah. Chia seeds, flax seeds, pumpkin seeds, I forgot to mention. These are really good. Pumpkin seeds are also very good. Pumpkin as such is a vegetable that we normally tell not to take too much when you are a diabetic, but pumpkin seeds are really good. So what I normally tell is, if you see, these are things that are not only applicable to diabetics. These are things that are applicable to anybody. Anybody can eat them because they have antioxidants. They affect your body in a positive manner. So if you want, but one thing you have to remember, chia seeds and flax seeds can cause flatulence. So you have to, for some people it doesn't agree. So please, when you start off something new, always start off with, using a little bit of it and then go a little higher. So don't use all the chia seeds and flax seeds at one time. Start with flax seeds, and then, if you're okay with it, then go in for chia seeds also. They are similar in nature. Pumpkin seeds are not, they don't cause too much of flatulence, so that's fine. But what I normally do is, you can mix it either with the water and have it in the powder form, or I sprinkle on the salad. Mix it with the salad and I have it that way. So either ways is fine, but it is a good thing to have chia seeds and flax seeds.
Yeah, so no, we generally, we put chia seeds, and it's like, it comes in I'll show you the pack. So we put it in water and let it sit for half an hour, and then we drink it.
Yeah, that's fine. You can have it that way. Either way is fine. Some people don't like too much of drink.
Shehnaz, there are two questions.
Yeah, I just saw, I am Sandhya, age 48 and into menopause. I am not diabetic, but my HbA1c is always, yeah.
Yeah, Shehnaz, there are 2 questions. There was a question where saying, what 3?
I can't hear you, Parveen.
Yeah, can you hear me now?
Yeah.
Shehnaz? Yeah. So there was this question about the 3 different oils which you suggest. So that would be like olives.
Okay, I'll answer. I think she's stuck a little. See, the 3 different oils that I would really like is, you can use it in the combination. See, normally what we say is saturated, monounsaturated, and polyunsaturated. 3, you mix it together, so you have the benefit of all the 3. Okay, but you should know how to mix it. That's very important. Like, for example, now ghee and coconut oil takes a lot of importance. It has gained a lot of importance. Those are saturated fats. So, but you have to go easy on them, not too much. Okay. Coconut oil also, the organic coconut oil is really good. That is not the refined one. So you can have that coconut oil only for, say, if you're making sambar, or if you're making, so instead of using ghee, you can use the coconut oil, or you can use a little bit of ghee in any of the food that you're preparing. The monounsaturated category is all the sesame oil, olive oil, your groundnut oil, all that come in the monounsaturated category. That you can use for cooking. If you are making your gravies, your biryani, or all that, you can use with your the sesame oil and your groundnut oil. And for frying, you can use the polyunsaturated, which is the sunflower oil, safflower oil, or your now why I was talking about rice bran oil is it is a good combination by itself. So if you can actually use rice bran oil, because the combination works very well, it has all the good components. So even if you don't have to mix too many oils, or you have to buy too many different oils and cook, that one oil itself will take care to one great extent. For your salads alone, you can have a little bit of olive oil. So that's why I said rice bran oil and olive oil, or you use the three different ones is coconut or ghee, and then you have your monounsaturated fat, and for frying, you can use sunflower, safflower, or whatever. And I think there's another question also. Somebody whose HbA1c is always 6.4. See, when your HbA1c is very high, more than 6 itself, it indicates that you're pre-diabetic. So I would, and since you're also going into menopause, I would suggest that you don't have to worry about it. If your fasting blood sugar level is controlled, then I don't think, if it is well below 110, then it's fine. But since it is 6.4, it is very important that you take care of your health. Please follow the guidelines that I gave you. Even with those hypoglycemic agents that I was talking about, adding a little bit of curry leaf powder, or drinking fenugreek water. If you do all that also, to one extent, your blood sugar levels will be controlled. As long as your fasting sugar does not go higher than 125, I think you're fine. So please, if you're a little worried, then buy a glucometer, and every day you don't have to check. Randomly just check your fasting blood glucose level and see. If it is under 120 or 110, then it's okay. But you seem to be pre-diabetic, as much as I can understand from the message that you've sent.
Sorry, I have one more question. Excuse me. You talked about HbA1c. So, so what should be the level? This is a very silly question, but a question.
I think anything over 5.9 is considered as pre-diabetic, if I'm not wrong. Yeah. Okay. 5.9, I think, is the upper limit. Okay. After that, you're considered as pre-diabetic. But let me tell you, the HbA1c itself is very important. I'm not saying it isn't, but it's very controversial, because some doctors don't give it too much importance. They give more importance to the fasting blood sugar level than to the HbA1c. But since it has gained importance now, I think let's not ignore something which is glaring in your eye. So if it is high, then no harm in taking care of your food and your health.
Yeah, right. Yeah, absolutely. Absolutely. Thank you. Thank you for that.
Somebody has written, can we begin with a cup of tea on an empty stomach? Yes, early in the morning.
There are some questions that I think you can take.
Yeah. I'm okay with you having tea, but I strongly recommend green tea for people who have health issues. Not that normal tea is bad. Yes, normal tea is good too. But if you look at the antioxidant level in a green tea, it is any day higher than a normal tea. So what I normally suggest people is have green tea with a little bit of lemon and a drop of manuka honey. It's a very good combination, and it is good for health also. It has, like, manuka honey is known to control your inflammation in the body and heal. If there is any problem, it also helps in the healing. So I always suggest you start your day with green tea, a drop of lemon, and a little bit of honey, manuka honey together. That is a good way. And you can have your breakfast after an hour. You don't have to give 2 hours break. After an hour, you can have your breakfast. Provided if you have an exercise regime in between, then I suggest you have something else also to eat before you go for the exercise. But if you're not exercising, then within an hour, I think you should have. The 2 hours is not necessary. See, always remember, the faster you complete your dinner and you go to bed, it's easier, rather than prolonging your day for a long time and then going too deep into the night and having your food and then having very short hours of not eating and then again start eating. That is, I think, a very wrong way of following your diet. So if you start your day early, finish it early, have a 10-hour break, and then you can start the next day all over again.
Assalamu alaikum, Sister Shahnaz.
Walaikum assalam.
I've got my hand up. Yeah. In the beginning of the talk, when you mentioned about diabetes, I think I kind of missed a little bit. So I just wanted to cross-refer and confirm with you. When you mentioned there's diabetes type 1 and diabetes type 2, right?
Right.
And both are incurable once they start, or is any one of them reversible?
Usually it isn't.
It isn't? Okay.
Usually it isn't. Usually once you kind of get it, you only have to manage it. The type 1 is more of the juvenile one, and type 2 is what you develop later on in life. But usually it's once you are into it, you have to manage it. But it's I would say that this is all about managing. Once you manage and keep your blood sugar levels under control, your life is not actually affected at all. I mean, everything works well, alhamdulillah. It's only when the blood sugar levels go haywire, that's when the problem creeps in. So as long as whichever diabetic whichever form of diabetes one has developed, as long as it is under control, it is fine. You just have to manage it well. But I don't think, in my experience, I have not seen anybody go back. I'm not aware of anybody that condition being reversed.
All right. Thank you for being honest. But I know once we get all the signs and we are actually pre-diabetic or diabetic is when people catch it. Are there any very early, how many years would you say it kind of stews in your system before it kind of comes out? Is there a way that you can catch it maybe 10 years before or 5 years before?
I said, one is your family history. Okay. So if supposing you're I don't know if you heard me, if one parent has had diabetes or if two parents have had, then you have a very good chance of getting. So that is one indicator where you should know if somebody has been, one of your parent has already had the disease, then you should be a little careful. But besides that, I wouldn't say there is any glaring sign, because there are so many factors that affect diabetes. For example, somebody might have some kind of a disorder and they might have they might be put on steroids. I know some people who have been on steroids, and as a side effect they've got diabetes later on. All right. So 10 years earlier to predict that one will get diabetes is too far-fetched for me. Especially if somebody has perfect health, if they are in a condition of perfect health and there's nothing gone wrong, there's no reason why one would believe that they will end up in diabetes unless they have a family history. But otherwise, if somebody is overweight or they are having obesity, or since childhood they've been having overweight or obesity, these are signs where you need to look out for. Or if you have any other condition, there is a good chance of you getting diabetes. But if you're normal and you don't have any weight problems, and you don't have, even for that matter, people who have PCOS, they kind of develop diabetes later on in life. So like I said, your body is kind of very complex, one connected to the other. So you never know. Some conditions are these: hypertension, PCOS, family history, overweight, obesity. These all can lead to diabetes. But for a person with perfect health, there's no way of telling they would or they wouldn't.
Fair enough, because I had read some other studies where they were able to predict if a parent got it in their 30s or late 40s, then there's a way of predicting that some diseases like can get it 5 or 10 years before. So there is no such indication as such with diabetes.
That's what I said. If a parent has had, then you have a chance of getting it. They say that 25% if one parent. If two parents have had, you have a good 50% chance. I think you're talking about people who have breast cancers. They develop the gene. If you have the gene, then I think you're talking about that. Yeah. So I specifically do not know if you can, isolate a case like that and whether you could. I'm not aware of it. I'm sure. I don't know.
Jazakallah khair. And just one more question. You mentioned that we should finish eating earlier,
right.
And timing is very important.
Right.
Alhamdulillah, most of us here are Muslims. So if we were to take an average Muslim day of when we wake up for Fajr and when we go to bed after Isha, so approximately when should your breakfast, lunch, and dinner slot in between these 5 prayers?
See, Isha can be done as soon as your time is up, right? You don't have to wait
Before you sleep.
Yeah, you don't have to wait for a long time to finish your dinner. You can finish your Isha as soon as it is Isha time, and you can still have your dinner and you can go to bed. Whether you go to bed or not early, it's important you finish your meal, well ahead you hit your sack, right? And for breakfast, once you get up for Fajr, like I said, you have your green tea and then give it 1 hour break and then you have your breakfast. See, 5 meals plus 3 proper meals with 2 snacks is what I normally say for a normal individual. That's fine. Okay. 5 meal pattern. You don't even have to go beyond that. So if you start your day at say 5:30, okay, you eat your breakfast at around 7 o'clock. All right. Then you leave a gap of 2 to 3 hours. Around 10 o'clock, you have a small, say a snack or a drink or something. And then you have your lunch at around 1 o'clock. And then again, you have your tea at around, say 4:30. And then you have your dinner by 8. You still have enough time in between. You've not really squeezed too much in one day. And from 8 o'clock till your 5:30, you have a proper intermittent fasting happening where you have not really eaten anything at all, which is good enough if you can follow that regime. But if you're a person who wants to eat dinner at 8 o'clock and you're going to sleep only by say 2 o'clock in the night, may not work for you because eventually you will get hungry. So hitting the sack, that is going to bed as early as possible, is the right way to do it instead of wandering too much into the night. Unless you're getting up for tahajjud and you're hungry and you want to eat something, that's a different case altogether. But otherwise, this would be an ideal way to follow your diet regime, because it's very important that you don't keep eating throughout the day. You're not really doing justice to your system, your metabolism. So you need to eat at fixed timing. Discipline in any way works, right? What does Islam also teach you? It teaches you discipline. So your food also, as long as you follow discipline in what you eat, when you eat, it is always better for a good or perfect health condition.
MashaAllah, Jazakallah khairan kaseera. That was quite helpful. I've absolutely enjoyed your talk. Jazakallah khair.
Thank you so much.
Yeah, anybody else coming in?
Somebody's asked, I think Shana, does curcumin, the essential component of, yes, somebody's asked if turmeric helps. Yes, turmeric does help. Like I said, turmeric not only helps in blood sugar level, it also helps for particular kinds of cancers also. So turmeric has gained a lot of importance now. So I suggest that you either have turmeric with milk, or you can have turmeric itself mixed with warm water. It is very good in controlling your blood sugar level. You can even have it in the night before you go to bed. But like I said, you please, if you have very borderline, if you're a borderline case and you're on a very low calorie diet already, then I suggest you do all this under the supervision of some healthcare professional, so that you don't go into hypoglycemia. But yes, it is very good. Curcumin, cinnamon, curry leaves, fenugreek seeds, ginger, garlic, zira, all these are very good, and including Amla powder. I don't see any other questions, Parveen.
Yeah. So I think we've had a very fruitful session. It's been wonderful. And yeah, I think we can take a whole another one full hour also. Shehnaz can keep on advising and we keep on listening. There's no end to it because always the questions are like, you know, the thing comes back like, you know, how to lose weight. And Shehnaz is like famous for that. Absolutely. She has helped us and helped us a lot. Like, you know, how to actually lose that. Not only that, maintain it. I think that's been like really amazing. It's brought a really a life change in many of us, Shehnaz. I think we're ever so grateful for that, for your advice. And Alhamdulillah. So now I start by thanking Allah subhanahu wa ta'ala for the success of this program. I extend a very hearty thank you to Dr. Ayaz Akbar, our Chief and Chairman of Oxymed Hospital, who spearheads the mission of health and well-being programs. I thank Shehnaz Gurrez for her insightful talk on diabetes and diet. I'm sure many of us here have learned many new aspects of diabetes. I would like to thank you for sharing your expert knowledge with all of us. I appreciate all our patients who trust Oxymed Hospital and give us continued support. Thank you. I thank the doctors, nursing staff, the dietary department, the technical and administrative team for their undying efforts at keeping the pace going. I once again thank all the audience who have taken out their time and come and benefited from the program. And I thank again all of you for your care and concern. May we together make this world a better place. Ameen.
Thank you. Thank you so much. It was a pleasure talking to all of you all. I really love to talk about food. So I enjoyed it.
I know the kind of food which you talk about. Really amazing. Alhamdulillah. Jazakallah. Jazakallah.
Thank you. Thank you so much.
Thank you. Bye-bye. Bye. Hafiz.